Okay. Today we have a physician assistant who was um, nice enough to do an interview with us. Go ahead.
I got you laughing too much, didn't I?
Yes.
Okay. My name is Ed McDonough. I'm a PA. I work for Physicians Medical Center. Um, I've been a PA for 23 years, and I'm working in urgent care right now. We also do motor vehicle accident evaluations and treatment.
Great. Thank you. Um, do you mind giving us a brief summary of your day as a physician assistant?
Um, well, I've worked in a number of urgent cares and some family practice offices, and I've also done some first surgery or first assistant um, surgery assisting. So it's pretty varied. Just kind of depends on what your specialty is. For me, we do walk-in care here, so I don't have anybody scheduled. So I come in, and as patients come in the door, the receptionist gets them signed to the computer. The nurse triages them, puts them in a room, and hands me the chart, and I go in and see them.
Great. Thank you. And I know this sounds pretty redundant and may even sound silly, but as a physician's assistant, what is your primary function or role?
Um, Basically, as the medical provider for the office, we don't have a physician on site. As a physician assistant, I work directly under a physician, but he or she doesn't have to be present when I'm practicing. They just have to be available by phone. So for the most part, patients come in, they see me as far as they're concerned. I'm their physician, but I'm not an MD. I'm a PA.
Gotcha.
So I provide the medical care, and that includes writing prescriptions, discussing their treatment options, ordering tests if need be, and again, as far as they're concerned, just like if they've been to see the physician, they've seen me. And if I have questions, then I would refer them on to their physician, or I would get a hold of my supervising physician for help in the case.
Great. What is the most beneficial or fulfilling thing that you like about your job?
I love helping people. People come in, they don't feel well, and hopefully I make them feel better. I like dealing with people. Obviously, I have the gift of gab, as you can tell.
Yeah.
I like to talk and I like to meet people, and that's kind of what I do.
Great. What is the most stressful thing about being a physician assistant?
Um, Patients come in, they don't feel well.
Okay.
It's my job to make them feel better, and that's a challenge sometimes. They come in, they're grumpy. Again, they don't feel well, and they may not necessarily get the answers that they want, or they come in and tell me, this is what I have, this is what I need, and yet that may not be what they need or what they have for that matter. And so I have to convince them that I know what I'm talking about, and this is really what they need, and help them to feel better about the treatment.
Great. And is psychology in the field of medicine important at all? And if so, how important is it?
Well, I think psychology is like one of the most important things that we deal with, we need to know about. Um, some examples. When a patient goes to the doctor, for the most part, they go to the doctor because they feel like crap. Okay, so my job is to use psychology to make them feel better. I have to figure out what to say to make them feel better. Um, Basically, I guess I would tell you that I'm kind of a salesman. I have to sell them their diagnosis and their treatment, and if I can't do that, they're not going to get better. They may get better over time, but it's going to take longer for them to get better than if I was able to sell them that this is going to make them better. This is what they need. They're going to get better. It's going to take a couple of days. I have to educate them in such a way that they're going to believe it, and they're going to trust me, and they're going to trust that they're going to get better. And I think that's all in psychology. It's selling them.
Great. Thank you. What actually led you to this career as a physician assistant?
Um, Growing up, I actually had no idea I wanted to be a PA or be in medicine. I didn't know anything about medicine. My dad was an airline pilot. All I ever wanted to do was fly. I kind of dropped out of college early on, joined the Navy, and My mom didn't speak to me for a month, but anyway, she said, "Look, you already know about flying. Why don't you try something else?" So I thought, well, I'll get into medicine and be a corpsman in the Navy. So I chose that and learned all sorts of things. I was working in the emergency room. I could suture. I could lance abscesses and boils and all that kind of stuff. And I thought, this is really cool. Decided I wanted to be a nurse where I could actually do more. Realized that actually there were things that I could do as a nurse, but they weren't things I necessarily wanted to do. About that time, PAs were becoming kind of big in the medical field, at least in the Navy. We had some PAs rotate through the emergency room, and I decided that was exactly what I wanted to do. I wanted to be a PA. So went back to college, went to PA school, and here I am. I mean, like I said, I love making people feel better.
Great. And deciding to go back to college to be a physician assistant, how challenging was that?
Very.
Very.
I joke around about how I thought PA was something totally different. I walk in and they handed me my beeper, my stethoscope, and I said, "What's this for?" They said, "So that you can do your job." And I said, "Well, how's that going to help me?" And they said, "What do you mean?" I said, "PA, party animal, right?" I mean, I was just out of college. I was in a fraternity. But the truth of the matter is, I get into PA school and I'm thinking I was a corpsman in the Navy. I knew it all. I was going to breeze through this. Then I started hearing about some of the experiences and what the other students were. Some were lab techs, some were nurses, some were various things. I hear their stories and it's like, wow, I don't know anything. The challenge at PA school was a 2-year program, and they say that we could do, by the time we graduate, 80% of what family practice docs do as far as treating the majority of patients. I don't know if it's really that high of a percentage or not, but regardless of that, my point is that it was pretty intense training for that 2-year period of time. It was very challenging. I learned that I knew some of the things to do prior to getting into PA school. I just had no idea why I was doing them, and those were some of the things that I learned about taking care of people.
Gotcha. And what keeps you motivated after experiencing a stressful day at work or a stressful situation, such as with a patient?
We see people at their worst. Again, people come in, they feel like crap. If I can make them feel better, I feel great. When I get, someone coming back saying, you took really good care of me last time, I came back to see you again, that makes me feel good. The more patients I see, the better I feel because I've accomplished something. Now, I don't want to see so many that it becomes an assembly line, but the other side of that is I want to work and be productive. And I love it when people come back and they say, "Yeah, I was here before, and you took such good care of me. I want to come back and see you again."
Great. What is one of the hardest things about being a physician assistant?
Sometimes there are turf wars. There are battles. We're kind of a new field. Even though we've been around for quite some time, you're seeing more and more PAs in doctors' offices and urgent cares and things like that. And occasionally we'll see people that will come in and, you have a doctor here, right? And, we tell them, no, we have a PA. And, "Oh, well, I want to see a doctor," and they'll turn around and leave. And, they may go to the emergency room where they're going to wait hours and hours, and yet they could have come in to see me. And when I say me, any PA, but, we could have seen them, have them treated, have them out of here, hopefully feeling better in a much less period of time. And their problems probably weren't difficult enough that they needed to see a doctor. Seeing a PA was adequate.
Right. Great. A final question. Are there any words of encouragement that you would like to give to any aspiring PAs or anyone venturing into the medical field?
I love what I do. As I said, I've been a PA for 23 years. It's challenging. Like I said, people come in at their worst, and my goal is to make them feel better. And if I've been able to do that the majority of the time throughout the day, I go home feeling productive, feeling like I've done something, feeling good about myself and what I do. I would encourage people to do it. I think it's a great field. Sometimes difficult, like I said, battling patients that don't necessarily know what PAs are or what we can do. but it's a great field, and again, challenging. And you asked where psychology plays into this. That's kind of the challenge. I've got to sell them their treatment and diagnosis, and a lot of times they come in with this preconceived notion: this is what they have, this is what they need, and I have to decide if that's correct or not. If it's not, I've got to sway that opinion and really convince them of that in order for them to get better.
Right. Thanks for the interview.
You're welcome. I enjoyed it.
Thanks.